Hello, everyone. Thank you so much for joining us today for our presentation as part of the Poison Prevention Program. Today is the second webinar in our series, Oh Baby, Household Safety for the Toddler. Last time we were here, we covered the ages of 0 to 12 months. So if you are interested in learning about household safety and poison prevention in that age group, feel free to go back to our previous live recording of that age group. Today, household safety for the toddler, we'll go ahead and cover ages 1 years to 5 years old. For anyone that is curious, my name is Amanda Hammond. I am the Clinical Toxicology Fellow here at the Georgia Poison Center, and I will be presenting this information today. The objectives for our webinar this morning are to describe poisoning risks that are specific to our age group 1 to 5 years. We're also going to discuss the most common ingestions specific to this age group, and then we're going to review basic home management of those ingestions and when it would be important to call the Poison Center. First, I'd like to talk about what are the risks to children in this age group and how can we minimize them. If you are someone who's already watched our previous webinar, I think what's really interesting about this presentation is that when we get to the section on common ingestions or most common ingestions in this age group, they actually correlate exactly the same as our 0 to 12 months. However, what really distinguishes these age groups in terms of home safety and poison prevention are these risks and the ways that we can minimize them. For children who are 1 to 5 years, the main risks of poisoning are underdevelopment of the caregiver and child relationship, a misunderstanding of the physical or self-regulatory skills of the child, and then a number of accessible poison storage locations. And I'll go into each of these points and explain them a little bit further. Regarding the development of the caregiver-child relationship, it's important that for caregiver and child, there is a development of trust and adequate supervision. Now, I'm sure anyone with a child aged 1 to 5 knows that adequate supervision is a very vague term. But this means an understanding of the child, a development, like I mentioned, of a trust between whoever is providing care for the child and the child themselves, and the use of that information to develop child-specific strategies for teaching and hazard reduction. Every child is going to be different, so the development of this relationship can help guide you to know what is most important about your child. Are they someone who likes to climb? Are they someone who is very good at opening child-resistant cabinets? Knowing those kind of particular details about the child in question can help create plans ahead of time rather than plans that are responsive once the child has already gotten into something that we hope that they wouldn't. Next is an understanding of the child's developmental progress. We touched on this briefly in our previous webinar, but developmental progress is worth touching on again because it's very different in children who are aged 1 to 5. When we look at children who are in this age group, we want to know their developmental level, their behavioral attributes, and their temperament and personality, because all of these things contribute to what physicians and psychologists call self-regulation, essentially the ability for your child or your toddler in this age group to control their impulses as well as regulate their emotions. This developmental self-regulation, kind of basically how well do they follow rules, is a really important factor in knowing whether or not your child is at higher risk for poisoning. Children go through natural exploration, of their environment all the time, but impulse control and the ability to focus on a task can be huge signifiers as to kind of previously, like we talked about, how to determine what is adequate supervision and how do I plan ahead of time to make sure that it's harder for my child to become poisoned rather than respond after the fact. The last part in terms of risks are the number of accessible poisons. So this includes things like where are the poisons stored? Are they locked away? Do they maintain safety caps and are they in their original containers? And remember non-risks such as plants and batteries. Diving into this just a little bit more, we would want to recommend that you store medicine, cleaning products, especially laundry products, including detergent and detergent pods, in their original packaging in locked cabinets and containers. Especially, it's better if they can be out of sight and out of reach of all children. It's also important to ensure that your safety latches are installed correctly and per the instructions on the packaging. Next, you want to be sure that you discard any unused or old medication. And note that safety caps and child-resistant caps are meant to be just that. They are child-resistant, not child-proof. In fact, the determination for child-resistant caps means that 85% of children who are less than 5 years old would be unable to get into the cap if given 5 minutes. With that in mind, we see that at least 15% of children who are less than 5 might be able to get into a child-resistant cap in less than 5 minutes, which is why it's important that we dispose all unused medication as well as expired medication. We also want to be sure never to place products that are poisonous in anything that resembles a food or drink container. Another important thing, kind of correlating with our last point in terms of non-medication risks, you want to secure things like remote controls, key fobs, greeting cards, or any children's books that have electronic music components, because these and other devices like them can contain small button cell batteries that are also potentially dangerous if swallowed by children. The last thing that can help us know the number of accessible poisons in a child's environment is knowing the names of all the plants in your home and in your yard. If you have young children or plants, if you have young children or pets, you should consider removing any plants that you determine to be unsafe or that you are found to be potentially poisonous. Moving forward, what are the most common ingestions? The most common ingestions in children 1 to 5 years of age are household cleaning products, cosmetics, and analgesics. Again, I will go into each of these categories and give a little bit more of an explanation. Regarding household cleaning products, they are what we would call acidic and basic chemicals generally. This means that commonly, their most dangerous properties include irritation and burning, and if a child were to get into it, it could damage their throat or their stomach and rest of their gastrointestinal tract. What this means, though, and the good news is that most household cleaning products, so anything formulated specifically to be used at home, these are products that we can find in our grocery stores and places like Walmart or Target, are generally very dilute. They're not very potent because the manufacturers understand that they're going to be placed in the home. This means if you witness your baby touch or handle the bottle without necessarily spilling or consuming any, they're likely fairly safe. Small spills or even very small touches could irritate the skin, but with gentle cleaning and ensuring that your baby or your toddler is safe and away from the product, then likely they're going to be safe and perfectly fine. Like I mentioned, if this should happen, you'll want to clean the skin gently with soap and water, watch for redness or swelling, and as long as none develops, you're fine to stay home. If your child or toddler goes ahead and swallows more than a taste of any household cleaner, while it's unlikely to be life-threatening, this would be a circumstance where we recommend that you call the Poison Center, and we can help guide you towards making the best decision for your child. The second most common ingestion is cosmetics. Cosmetics and personal care products are a really wide category of products that range from makeups to soaps, perfumes, and more. And often they can be fairly harmless. So, for example, Desitin and white petrolatum are often something that kids are exposed to. And this was something that we touched on in our previous webinar as well regarding when it's available on the changing table, kids love to reach for it. But the good news is that while this product might give your child some tummy issues, small ingestions very rarely require medical attention. Now, baby powder is a slightly different story and also something that people often leave on the changing table. The good news is the majority of more recently produced baby powder is cornstarch, which is a lot safer. It's replaced an active ingredient that we used to use called talc. Talc, unfortunately, can be fairly dangerous if it goes down the wrong tube. So if a baby or a toddler tries to swallow it and it goes uh, down into the lungs, it can cause a really nasty pneumonia. And so you'll want to check your baby powders in terms of cosmetics and personal care products because talc baby powders are best kept, well away from a toddler's reach. Again, kind of what this means in terms of management is to be sure to keep cosmetics out of reach of our toddlers, especially when they're not in use. Keep in mind that when you are keeping things on the changing table and your hands are busy, that exposes your toddler to a risk. But if your child gets into a cosmetic product, be sure to carefully and gently clean out their mouth with soap and water as previously discussed. And if it was witnessed and it is a small taste or less, you can likely comfortably watch your child at home as long as they have no symptoms and they're acting normally. One thing I lastly want to point out about cosmetics is that this does not include, so the advice that we've given does not include any essential oils such as oil of wintergreen or herbal supplements or any cosmetic products that are purchased as OTC or over-the-counter medications. For example, acne cream or ointments or creams with medical active ingredients. If there's any concern regarding the amount that your child consumed of any cosmetic or personal care product, or what exactly the product itself is, you're always free to call the Poison Center and we will be happy to guide you about management of that particular ingestion. The last thing we'll touch on for today are analgesics. So analgesics are over-the-counter pain medications, things like aspirin and acetaminophen or Tylenol. Ibuprofen is another. Anytime that a toddler consumes a medication that wasn't intended for them, or a medication that perhaps was given at the wrong dose, you should call the Poison Center so that we can accurately guide you towards whether or not this patient needs to be seen by a medical provider or can be watched at home by you. If you're curious about advice regarding dosing medications appropriately with spoons or cups or syringes, you can also visit our previous webinar where there was a thorough discussion on managing the dosing of medications appropriately. The last thing, of course, is to just know our number. If you ever have a question about anything that was discussed today, or a more important question about your child if they've actively consumed something, go ahead and just give a dial to 1-800-222-1222. We are always here and we are always happy to help. We thank you so much for taking some time out of your day to participate in poison prevention, and we look forward to talking to you next month about children who are a little bit older. Thank you so much. We will open the chat for questions and watch that for just a moment. All right, seeing as there are no questions, we'll go ahead and close out the webinar for today. But as I mentioned, if you do have any questions watching this at a later time, feel free to post them or contact us here and we'll be happy to help you. Thank you so much and have a great day.